hocam.
Evet, ikiniz tek kameraya mı geldik? Çatıyor.
4 dakika var hocam, isterseniz
Evet.
introduction verebilirsiniz.
Başlayalım o zaman. Dear guests, hello everyone. Welcome to session 24. There's going to be 3 presentations in the session. And the first one will be by Abdullahi Ibrahim Janay, Assessment of Managerial Practices at Selected Teaching Hospital in Khartoum State, a case study. The second one is Status of Cigarette Smoking and Factors that Indulge in Cigarette Smoking Foreign Students Studying in Fırat University, Elazığ, Turkey, by Bukhari, Abubakar Adam. And the third and last one will be Pamukkale karda ipliklerde iplik numarasının iplik kalitesi üzerine etkileri, Özdemir ve arkadaşlarının çalışması. Each presentation will be 15 minutes, including the question and answers part. So I will ask the presenters complete their presentations in at least 12 or 13 minutes so that we will have enough time for questions. And if we are ready, we can start with the first presentation by Abdullahi Ibrahim Janay. Is he?
Okay. Yes, I am here. I'm ready. Okay.
Okay. You can start. Thank you.
Okay, thank you. Welcome, everybody. And firstly, I welcome the host and the other participants. Here, I will share my presentation. Okay, my name is Abdullahi Ibrahim Janay. I am a PhD student at Düzeyli University in Izmir, Turkey. I study in public health department. My paper subject is Assessment of Managerial Practices at Selected Teaching Hospital in Khartoum State, a case study. Here, in this paper presentation, I will talk about background and objectives, methods, results, and conclusions. As you see, the subject of the study is works on hospital management. So firstly, we must define what is hospital management. The hospital management consists in 2 words, hospital and management. Okay, what's management? Management is defined in many ways by many authorities, but the original definition by Henry Fayol, who is considered the father of modern management, stated that to manage is to forecast and plan, to organize, to command, to coordinate and control. If we conclude this statement, we can say management consists of planning, organizing, directing, and evaluation. So the study assessed these 4 factions: planning, organizing, directing, and evaluation. So when we talk about the hospital, specifically, we work and we make the study in teaching hospitals. The teaching hospitals is not especially in hospital and not different from other hospitals unless it has other or further works, which is training and research. Okay, as we said, selected teaching hospital. The selected teaching hospital was Ibrahim Malik Teaching Hospital. And why we took this hospital? Because this hospital was district hospital, and there is levels of hospitals. The district hospital is only for district, then change it to central hospital for some districts. At that time also was used for training of medical students. So the work of the hospital, when it's changed, become more complex, having to adopt various managerial practices. So I select this hospital. Okay, why we talk about hospital management? Because hospitals constitute the most important components of the health systems. Also, and they give direct delivery of healthcare services. So studies on hospital management will save the health system resources. Also, they will improve the delivery of healthcare services. So studies show that hospital management and its mode of government influence different aspects of hospital performance. Even a survey demonstrated that hospital management practices do correlate with the clinical outcomes. The clinical outcomes will be good, like mortality rates will reduce. Also, the patient satisfaction will increase. Also, in Sudan, there are no more researches about hospital management. So this work or this study was in Sudan, not in Turkey. Okay, the objective of this study was assessment of managerial practices of selected teaching hospital, as we said, in order to improve the strategies of providing services and also teaching, the work of teaching and research. The assessment was, as we said, in the management practices, which is planning, organizing, coordinating, and evaluating practices of the hospital. And the dimension is also assessed the 3 M's management: money, materials, and manpower. We say 3M. And these 3 M's management, also time management practices of the hospital. The method is study design. The study design was a cross-sectional, hospital-based study. Study area, as we said, the study was in Sudan, especially in Khartoum State. The period was 2018, the beginning of the 2018 in January. Study population, as the study assesses the managerial practices, the study population were hospital managers, like general manager and the department managers, also the supervisors. The sampling technique was total coverage, randomly total coverage of the hospital managers. So data management was, and we made a data and a questionnaire to assess the planning, organizing, directing, and evaluation practices of the practices in money, material, and manpower, also and time management practices. Ethical consideration. The study was approved firstly in the university, secondly in the Ministry of Health, Khartoum State Ministry of Health. So the result is, how the result is become, the hospital administrations were 57.9% male and 42.1% female. About 42% of these managers were married. About 21% had a bachelor certificates, while some of them had higher degrees and some of them had technical diploma certificates. After we assessed the managerial practices, the hospital administrators received good average scores, and their practices were good. And when we used in SPSS, it was 1 to 1.75. This is we made 1 to 1.75 is very good, and 1.75 to 2.5 is not good. There's other we use the Likert 4 type style, and which consists yes, no, and now, and not applicable. So we took these two, yes or no. They said in the good practices, the answer rate 1 to 1.75. Yeah, means yes. And it was like this. Planning was like 1.3, between 1.75, organizing 1.34, directing 1.31, all was like this. And material management, money management, manpower management, time management. So like that. Also totally, and the total managerial practices were also good. However, hospital administrators got low, very average scores. And when we say low average score, between 1.75 to 2.5 in some variables, not all, in some variables within these dimensions or these factors. And was this preparedness to internal fire disasters? They got 1.75, means low. And the low will be, or when they answer it in no, will be 1.75 to 2.5. Like this. Financing from other than government sources. This is related to money management. And this is preparedness to internal fire disasters is related to planning, also related to human resource management. Also, adequacy of healthcare workers was low, was no adequate, and this is related to planning also, or organizing, and also related to human resource management. Evaluation of satisfaction rate of customers, and they were not evaluate, because evaluation, when you evaluate, will increase the performance of the hospital. So they didn't evaluate, means were low. So they were low in this dimension, in this factor of evaluation. It's related to evaluation. These factors were low, but the general, they were good. When we did, also we used in SPSS in descriptive statistics, mean and mode, and we got like this low and high, or good or not, or bad. Also we used this type of statistics, and we got weak positive relationship between materials management and money management. Also, there is a positive relationship between money management and directing, means when there is no in money management practices, maybe which affect the directing, we cannot direct the people like that. Also, observe it, and weak positive relationship was observed between time management and planning.
2 minutes left.
Okay, I finished. The correlation is significant at 0.01 level, one-tailed, or 0.0505. This is the tool we used, as I said, questionnaire. Also total coverage, this is the sample size. Based on the conclusion, based on results from the study, there are some recommendations, which is for hospital managers, we recommend launching urgent initiative programs to concentrate and enhance specific aspects of hospital administrators, which we said that for thinkers, we said they were low. For health policymakers, we recommend giving hospitals higher levels of autonomy in managing, including financial budgeting to take from other sources, and human resource management. Some human resources are managed from the hospital, from the health Ministry of Health, and they work in the hospital, so they have not high levels of autonomy. So, and also recommend defining clearly responsibility for public hospitals and Federal Ministry of Health and Khartoum State Ministry of Health. Thank you. If there is any questions, you can ask.
Are there any questions?
What? Sorry?
Are there any questions?
Yes, I asked him like that.
Yeah. I want to ask something.
Okay, welcome.
You conducted this study in 2018, right?
Yes.
Before the pandemic.
Yes, before the pandemic.
I want to learn what you think, what some additional measures to take in the management of the hospitals you would suggest during a pandemic.
During the pandemic, will be the important thing will be infection control. Infection control, we must add infection control. This will be another topic, how to how can we do infection control in the hospital, or how can we prevent or control the infections in the hospital. So we can add this topic in this research.
Okay,
This time.
Thank you. Thank you for this very informing presentation.
You are welcome. Thank you.
If there is not any other questions, we can start the second presentation.
Okay.
Is the second presenter here? Is Bukhari Abubakar Adam here?
Yes, I'm here.
Okay, you can start now.
Okay, let me send my PowerPoint. So I can start?
Yeah, sure.
Okay. Hello, everyone. I'm Bukhari Abubakar Adam. I'm from Nigeria. I study in Fırat University, Elazığ, Turkey. So I'm here to present my research work on status of cigarette smoking and factors that indulge in cigarette smoking among foreign students that study in Fırat University, Elazığ, Turkey. So the content of this research work, it is include introduction, aim and objective, methodology, result and discussion, conclusion, recommendation, then reference. And let's see introduction. A cigarette is a narrow cylinder containing psychoactive fabric, normally tobacco. It is rolled into the paper for smoking. Most cigarettes comprise reconstituted tobacco product called a sheet. They consist recycled tobacco, steam, stock, scrap, collected dust, and floor sweeping, which are bound glue with chemical compound and filter. The product is then sprayed with nicotine that was extracted from the tobacco scrap and fashioned into ringlet. So the history of cigarette. The early form of cigarette have been similar to their prototype called cigar, which has appeared to have antecedent. Around 19th century in Mexico and Central America, form of breed and smoking tubes has been introduced. Cigarette smoking has a very addictive chemical called nicotine, certainly as one of its primary constituents. The North American, Central America, and South America use various plant wrapper in cigarette. When it was brought back to Spain, maize wrapper has been introduced. Hence, by 17th century, excellent paper has been introduced also. The harmful effect of smoking. When an expected mom uses cigarette, there is increased risk in giving birth to a child with birth defect, which encompass intellectual and physical disability. In cigarette smoking, there is increased risk of developing oral and lung cancers. People who smoke additionally suffer from other situations like bronchitis, emphysema. Secondhand cigarette smoke is similarly dangerous. Prolonged exposure results in lung cancer or even heart problems. Smoking is a primary cause of mortality and morbidity among the developing countries, which is approximately 4 million people who smoke die annually from smoking-related diseases. So, aims. The aims of this research work is to investigate the status of cigarette smoking and the associated factors that indulge or make foreign students in Fırat University to smoke. Then objectives. The objectives of this research work is to determine the status of cigarette smoking among students and also is to investigate the associated factors that indulge the students smoke cigarette. Method, setting and study design. The universe of this descriptive and cross-sectional study of the research work consists of foreign students studying in Fırat University, adolescent and young adults, foreigners, both undergraduate and postgraduate, recruiting from all faculties in the university, from the various courses program, who reside at its main campus, hostel, and out campus. Then sample size. When decided on the sample size, this formula was used and the probability occurrence considered at P is equal to 50%, T is equal to 1.96, and D is equal to 0.5 at 95 confidence interval. At the time of study, list of all foreign students from the university were received. There were 1,725 foreign students enrolled in Fırat University. Student samples were selected from that list using systematic method. After excluding an incomplete and unsound response, I utilized data from 337 students. And the research was approved by ethical committee at Fırat University also. Then data collection. Data collection was carried out through the administration of questionnaire, and I was made a pre-test before actual data collection instead for getting a valid data. The questionnaire consists of 3 parts. In the first part of the questionnaire, there are socio-demographic data. In the second part of the questionnaire about smoking. In the third part of the questionnaire about progesterone nicotine addiction test, along with smoking characteristics. Then statistical analysis. The data analysis was carried out in computerized manner using SPSS version 23.0 package program. Chi-square test and logistic regression was considered. The quantitative data were analyzed using frequency table and percentage, where means are given with standard deviation. The results were evaluated at 95% confidence interval, and statistical significance phi value is less than 0.05. At value of less than 0.05 were accepted as being statistically significant. So result and discussion. So the overall result of the quantitative study is 337. Student data were evaluated. 17.2% were female and 82.8% were male, so that most of the respondent is male. Student mean age was 23.61 plus or minus 4.68 years, which is shown in table 5. The smoking rate of smokers who tried to smoke at least once was 36.5%, which is 123. But the current smokers were 31.8%, which we have 107, whereby 68.2%, which is 230, are non-smokers out of 337. Hence, male smokers are 82.2%, which is 88 frequency, 88, and 17.8%, which is the frequency is 19, which is our female from the population. So this is life status of cigarette smoking. The life status of cigarette smoking, we have 38 for 31.8% male smokers and 82.2, which is male, and which are male, respectively, from the population, which is the figure is comparable to the found according to the data from the 2012 Global Adult Tobacco Survey. In Turkey, smoking rate was 41.5% among men and 13.1% among women in other research. So from this table, we can see that those people that try to smoke, we have 123 number, and we have 36.5, and those people never smoke, we have 214, and the percentage is 3.5, and also the cigarette smokers, we have 107, and non-smokers, we have 213, and also the percentage is 31.8 and 68.2. So, and also the gender, we have 279, and for male, and for female, we have 58%. So that is the table of life status of cigarette smoking. Let us move to chi-square analysis. This chi-square analysis shows the distribution of some characteristics of students according to smoking status. The status of smoking of the foreign student situation was the first evaluated in Fırat University. That was not possible to make a comparison against the smoking and alcoholic status of the university student in previous years, but we consider the general frequency of the smoking rate among the students of Fırat University, which was 25.8%, hence 15.4% of the smokers are smoking at least once a day. This data we collected by the previous research by for this auto in a test of doctoral thesis. So this is the table of the distribution. This is a table that shows the distribution of some characteristics of students according to smoking status. For gender, we have the number of 88 who smoke, and we have, for the female, we have only 19 who doesn't smoke, who smoke also, and we have 191 who doesn't smoke. From the population of male, we have 279, and also we have non-smokers 39 from the female. From the population of 58,
you have 5 minutes left.
From the population of 58. So that is the table that shows the distribution of some characteristics of students according to smoking status. So let us move to another slide, so that reason for smoking. From this table, we can see that the reason of cigarette smoking among the students in the population are first reason for the smoking are engagement, then later pleasure or joy. That is the reason for smoking among the students. So progesterone nicotine addiction test. This is show the distribution of students who experience that they are currently using cigarettes according to the level of addiction. The mean progesterone test score among the student smokers was 1.6825 plus or minus 0.4662 among the students that smoke stick of cigarette 10 or less a day. So 53% was not are the most frequent answer, followed by those who smoke 21 and 30. Then the stick of cigarette, which is 10.3%. Then barely one are those who smoke stick of cigarette 31 and higher. This is the most few one. So because of that, hence non-smokers are 68.2%, and the overall average number of stick of cigarette smoking in a world population study is about 1,790 stick of cigarette in a day. That is shown in table H. Then rate of nicotine. The rate of nicotine according to the level of addiction showed that about 79% of respondents who are smoke cigarette different levels show a very low. Table 9 and 10 show that. If you see that, very low is we have about 78.5%, and low we have 14.1. So the rate of nicotine, it show a very low for the population. Then binary reduced regulation. Binary reduced regulation analysis revealed factors associated with cigarette smoking status. The effect of this variable, it was seen in a table. Let's check the table. This is, we can see that in a region in sub-Saharan Africa and Middle East, we have this at this confidence interval, and it is statistically significant. And also all the positive factors associated with cigarette smoking, and all variables are statistically significant associated with cigarette smoking. When the effect of this variable, the key out ratio is less than 0.05 in any variable. Hence, odd ratio greater equal 0.05 considered as a law and cannot be associated or influence cigarette smoking by the population. So that if you look for this, we can see for the Muslim, for the Christian, they are all statistically significant. So let us move to conclusion. Let us move to conclusion. In conclusion of this research, 82.8% of the students included in the study are male, and their average age are 23.61 plus or minus 4.68 years. 36.5% of foreign students said that they try smoking, and 31.8% still smoke. The frequency of smoking hookah is 24.0, and frequency of foreign students drinking alcohol beverage is 13.4. According to the progesterone nicotine addictive test of the smoking.
Last 1 minute, by the way.
So, had 78.5% of the respondents who are smoked cigarette dependency levels show very low. Then recommendation. Finally, I suggest that to decrease smoking among this population and other university students, prevention such as offering students social, sport, entertainment may be capable and effective solution. Smoking bans on university campus decrease the smoking rate. Hence, the university in this current study has no such ban. Turkey has followed Empower policy and increased the cost of cigarette and alcohol tax to discourage individuals from drinking or smoking. And also teachers and other stakeholders should deliver health education about the health risks associated with smoking. Restricted accessibility, such as advertising of substances like cigarette, alcohol, and other illicit illegal drugs are highly recommended. It is essential for a government to review tobacco control policy to determine how effective they are from the university student, because smoking and drinking are result may be related, not only social life, but it is affect student academic sources at all. So that is the reference, and I can say thank you for the listening.
Thank you for this very informing presentation. We don't have any time for questions now, but after all the presentations are finished, if anyone wants to ask something, we can take the questions.
Okay, no problem. I will be there.
Thank you again.
Okay, thank you so much.
Bu Pamukkale karda ipliklerde iplik numarasının iplik kalitesi üzerine etkileri isimli sunumu yapacak olan arkadaş burada mı?
Yok hocam.
Yani, okay, then the next presentation will be held by Malath, Nejres. Abubakar, can you stop sharing your screen, please, so that Malath can share his one?
Merhaba hocam.
Merhaba. Şu an Malath'ın ekranı bende görünmüyor. Size görünüyor mu arkadaşlar?
Hocam şimdi
Yok, biz sadece Abubakar'ın slaydı görüyoruz.
Evet, Abubakır'ın ekranı görünüyor.
hala mı? Şimdi benimki çıktı mı?
Evet çıktı.
Geldi.
Başlayalım mı?
Başlayabilirsiniz. Buyurun.
Full
Tamam.
screen yapabiliriz.
Buyurun.
Size ilk önce ben Malath'ta Nejres Ege Üniversitesi'nden mezun oldum 2 hafta önce. Size düzeyli ve çok doğumlu akıllı telefon ağlarında dağıtık algoritmaların uygulaması ve değerlendirmesi isimli tez çalışmamı sunuyorum. Dağıtık sistemler farklı konumlarda bulunan ve birbirleriyle işbirliği yapan işlemcilerden ya da bir dizi düğümden oluşmaktadır. Bu sistemlerde her düğüm kendine özel işlemci ve birliği bulunmaktadır ve düğümler arasındaki iletişim ve etkileşim gönderilen mesajlarla gerçekleşebilir. Dağıtık bir sistemin temel gereksinimleri düğümlerin bağımsız bir şekilde çalışmalı ve her bir düğüm kendi işlemci ve birliğine sahip olmalı ve her bir düğüm başka bir düğümle doğrudan ya da dolaylı olarak bir iletişim bağlantısına sahip olmalı ve ortak hedeflere ulaşmak için işbirliği yapmalı. Bu işbirliği sağlamak için düğümlerin arasındaki bir koordinasyon algoritması olmalıdır. Bu algoritmalar genel olarak dağıtık algoritmalar olarak isimlendirilir. Dağıtık bir algoritma merkezi bir koordinatör olduğunu varsaymadan dağıtık bir sistem üzerinde çalışan algoritmadır. Örnekleri lider seçme, lider election İngilizcesi, genişlik öncelikli arama, derinlik öncelikli arama ve minimum kapsayan aracı. Çalışmanın amacı ve katkısı. Eş düzeyli ve çok düğümlü akıllı telefon ağlarında dağıtık algoritmaların uygulaması ve değerlendirmesi için bir iletişim ve mesajlaşma altyapısı oluşturduk. Ve bu çalışmada mevcut akıllı telefonların eş düzeyli iletişim servislerini kullanan bir yazılım kütüphanesinin geliştirilmesi hedeflenmektedir. Ve bu kütüphane aracıyla akıllı telefonlardan ulaşan eş düzeyli ağlarda lider seçme, kapsayan ağaç oluşturma ve yönlendirme gibi çeşitli dağıtık algoritmaların uygulaması ve değerlendirmesi daha hızlı ve daha kolay olabilecek. Neden akıllı telefonlar? Çünkü bu cihazlar maliyetleri düşük ve son yıllarda bu cihazların bellek ve işlemci gücünü oldukça arttı. Bir de Bluetooth, Wi-Fi ve çeşitli iletişim araçları destekliyor. Yani onları dağıtık sistemlerine uygun bir altyapı adını çevirmiş. Evet. Bu çalışmada dağıtık algoritmaları uygulamak için mevcut akıllı telefonların eş düzeyli iletişim servislerini kullandık. Lider seçme problemini dağıtık bir şekilde akıllı telefonlardan oluşan bir ağ üzerinde uygulanan bir Android programı geliştirdik. Program Android Studio platformu ve Java diliyle yazıldı. Ve söylediğimiz gibi geliştiren program yani diğer uygulamalarda bir Java kütüphanesi olarak kullanabiliriz. İki tür iletişim sistemi kullandık. Dağıtık algoritmaları uygulamak için Wi-Fi ve Bluetooth. Lider seçme algoritması dağıtık algoritmalarda sistemin işlerini yapmak için bir dizi düğümden lider veya koordinatör bir düğüm gerekebilir. Ve yani lider seçme algoritması lider veya koordinatör olacak bir düğümü seçmek için kullanılan bir tekniktir. Algoritma her düğümün benzersiz bir kimliği olduğunu varsayar ve kullanılan yönteme göre en yüksek ya da en düşük kimliğe sahip bir düğümü lider olarak seçer. Bizim kullandığımız yöntemde düğümlerin kimlik numarası kullandık ve bir lider üreten düğüm en büyük kimlik numarasına sahip düğümdür. Evet, geliştirilen sistem burada yani kullanıcı sistem açınca hangi iletişim sistemi kullanacağını seçer. Wi-Fi ya da Bluetooth. Ve burada enter node ID ve OK düğmesine basıyor. Her bir düğüm benzersiz bir kimliğe sahip olduğundan emin olmak için kullanıcı tarafından girilen kimliği kontrol edilir. Ve bu yani kullanıcı tarafından girilen kimliği kontrol ettikten ve başka düğüm kullandığını öğrendikten sonra bir mesaj kullanıcıyı başka bir kimlik numarası girmesi konusunda bilgilendirecektir. Burada eğer yani başka bir düğüm tarafından kullanılmazsa bu kimlik numarası yeni bir activity açılacak. Bu Wi-Fi activity. Burada bir yayın mesaj tüm düğümler yani ağdaki diğer düğümlere gönderebiliriz. Ya da bu sağ üst köşesinde bulunan seçim başlat düğmesine tıkladığında lider seçim sürecini başlatabiliriz. Wi-Fi tabanlı altyapı bizim kullandığımız yöntem yani lider seçme yöntem Wi-Fi tabanlı altyapı genel olarak aşağıdaki adımlarla özetlenebilir. Bir düğüm lider seçim sürecini başlattığında kimliğini içeren bir seçim mesajını ağda bulunan tam diğer düğümlere yayınlar. Ve alıcı bir düğüm bu seçim mesajı aldığında alınan mesajdaki kimliği kendi kimliğiyle karşılaştırır. Burada iki durum var. Bir alınan kimlik kendi kimliğinden küçükse gönderici düğme bir OK mesajı gönderir ve lider seçme sürecini kendi kimliğiyle yeniden başlatır. Ve eğer alınan kimlik kendi kimliğinden küçükse alıcı düğümü hiçbir işlem yapmaz ve lider düğümünden bir lider mesajı bekler. 3 lider seçme sürecini başlatan bir düğüm bir OK mesajı aldığında hiçbir işlem yapmaz ve lider düğümden bir lider mesajı bekleyecek. Bir düğüm lider seçme sürecini başlatıp kendi kimliğini gönderdikten sonra belirli bir süre bekleyecektir. Yani yanıt mesajı alınmazsa yani bu en büyük kimliğe sahip olan düğüm alanına gelir. Kendi kimliğini içeren bir lider mesajı tüm diğer düğümlere gönderir. Burada demo yaptık. Her düğüm için benzersiz bir kimlik girdik. Burada yayın mesaj. Burada lider seçme süreci başlattık. Şimdi tüm düğümlere en büyük ID 10. Evet. Bluetooth tabanlı altyapı Bluetooth'ta broadcast olmadığı için biraz yani uzun süreç olacak. Yani tam ağdaki tam düğümlere bir yayın mesajı gönderilmez. Bunun yerine gönderici ve alıcı Bluetooth cihazları arasında bağlantı kurulduktan sonra mesaj gönderebiliriz.
4 minutes.
Evet.
Last 4 minutes.
Tamam hocam. Bir kullanıcı yani direkt bu sayfa açılacak. Bu aktivite kimlik numarası girdiğinde burada seçim mesajı burada aynı şekilde başlatabiliriz. Burada yöntem başlangıç doğumu, yani lider seçme sürecini başlatan doğum her seferinde kendisine bağlı olan diğer doğumlara kimliğini içeren bir seçim mesaj gönderir. Yani kendisine bağlı demek kendisine eşleştirilmiş cihazlardan biriyle, yani örnek atıyorum başlangıç doğumu doğumuna iki ya da fazla cihazlar ona bağlı iki ya da fazla cihazlar varsa ilk şey başlangıç doğumu bu cihazlardan biriyle bağlantı başlatır ve gerekli işlem bittikten sonra bu doğumla bağlantıyı kesip diğer doğum cihazlara yeni bağlantı açıyor ve öyle devam ediyor. Alıcı bir doğum seçim mesajı alırsa gönderici doğumu yani parent olarak seçecek. Bir doğum lider seçim sürecini başlattığında lider veya wait mesajı olmak üzere iki tür mesaj için belirli bir süre bekleyecektir. Başlangıç doğumuna bağlı belirli bir doğumdan alınan böyle bir mesaj yoksa bu doğumdan yanıt alınmadığını gösterir. Yani o doğum boştadır. Bu nedenle başlangıç doğumu alınan lider mesajlarından birini seçerek en büyük kimliğine sahip doğumu lider doğum olarak ilan edecek. Süreç seçim mesaj tam doğumlara ulaşana kadar devam edecek. Ve başlangıç doğumuna kendisine bağlı olan tam doğumlardan lider mesajları aldığında en büyük kimliği sahip doğumu lider doğum olarak ilan eder ve lider seçim işlemini tamamlar. Lider seçim süreci bittikten ve lider doğumu sildikten sonra hangi doğumu lider doğum olduğunu konusunda bilgilendirmek için başlangıç doğumu lider kimliğini dahi diğer tüm doğumlara gönderebilir. Gerek yok. Karşılaştırma Wi-Fi bağlantısı kullandığında söylediğiniz gibi ağdaki tüm doğumlara bir yayın mesajı gönderebiliriz. Bluetooth öyle bir şey yok. Wi-Fi bağlantısı daha hızlı ve daha garantili. Bluetooth bağlantısı yavaş ve garantili değil. Sonuç merkez sistemlere göre dağıtık sistemlerin çeşitli avantajları bulunmaktadır. Akıllı telefonların belli kapasite, işlemci gücü ve bağlantı araçları arttığı için bu cihazlar dağıtık sistemlerin bir uygulama platformu olabilirler. Bu çalışmada akıllı telefonlardan oluşan bir dağıtık altyapı oluşturulmuş ve lider seçme problemini dağıtık bir şekilde akıllı telefonlardan oluşan bir ağ üzerinde uygulanan bir Android programı geliştirilmiş. Ve en son geliştirilen sistem hem Wi-Fi hem de Bluetooth bağlantılarını desteklemektedir. Teşekkür ederim.
Biz teşekkür ederiz çalışmanı bizlerle paylaştığın için. Bir 45
Sorusu
saniye
olan var.
kaldı. Sorusu olan varsa eğer. Sanırım soru yok. Teşekkür ederiz Malath.
Rica ederim.
Bu 2001 numaralı sunumun sahibi burada mı acaba? Geldi mi? Pamuklu karde, ipliklerde.
Hocam herhalde katılmayacak onlar.
Herhalde katılmayacak. Ebu Bekir'e sorusu olan var mı? Süresi yetmediği için soru alamamıştık. Ebu Bekir burada mı?
Burada.
Soru
Ebu Bekir.
Ebu Bekir'e.
Herhalde yok hocam.
Herhalde yok. O zaman öncelikle size hocam bu güzel organizasyonu yaptığınız için size ve ekibinize teşekkür ediyorum. Sonra da değerli katılımcı arkadaşlara çalışmalarını bizlerle paylaştıkları için. O zaman herhalde bu...
Hocam biz de size
katkı ve destekleriniz için teşekkür ederiz. Bizi yalnız bırakmadınız.
Her zaman hocam.
Size ve katılımcı arkadaşlara da sunumları, katkıları ve destekleri için aynı zamanda 2 gündür büyük bir gayretle çalışan sekreterlerimiz Ala, efendim Hande, Ahenk ve Malath da ekibimizdeydi. Alif, hepsine de buradan ben teşekkür ederim ayrıca. Sizlere de teşekkür ederim.
Ben de teşekkür ederim. Teşekkürler hocam. İyi akşamlar.
Görüşmek üzere.